Hello, my name is Idris Wiper and I'm a nurse and educator at the Karmanos Cancer Center. I would like to spend some time talking to you about dealing with the side effects of chemotherapy. It is important to remember that there are many different types of chemotherapy, and your doctor has chosen a chemotherapy specifically to treat your cancer. Just like no two people are exactly the same, no two people will respond to chemotherapy in the same way. Many patients often wonder why side effects occur. Chemotherapy can produce side effects just like any other type of medicine that we take. This is because chemotherapy affects rapidly growing cells. Unfortunately, both cancer cells and certain normal cells grow rapidly and may be damaged by the chemotherapy. Normal cells that are often affected are hair follicles, cells lining your mouth and throat, esophagus, stomach, and intestines. Also, cells that are made by the bone marrow, such as white blood cells, red blood cells, and platelets, may be affected. Your healthcare team will discuss with you possible side effects related to your treatment. This does not mean you will have all the side effects discussed with you. If you have side effects, tell your healthcare team and they will help you manage them. How severe and how long each side effect lasts is different for each person and chemotherapy. We will now discuss how to manage the common side effects of chemotherapy. There are several common side effects of chemotherapy, and the good news is that they will soon go away once chemotherapy has ended. The common side effects of chemotherapy are fatigue, hair loss, nausea, vomiting, diarrhea or constipation, mouth changes, and a decrease in your blood cell counts. Fatigue from chemotherapy can range from a mild to extreme feeling of being exhausted. Many people describe fatigue as feeling weak, weary, and worn out. Although you may feel tired and experience fatigue due to the long day and anticipation of starting treatment, fatigue can also be due to your chemotherapy medication. Some of the things that you can do to help manage the symptoms of fatigue is plan rest periods throughout the day. It is important to relax, rest when you're tired, but remain as active as you can. Research has proven that light exercise such as walking will ease the symptom of fatigue and help you sleep better at night. Try not to overdo it and listen to what your body is telling you. If people ask if they can help you, let them help you. If you continue to struggle with the symptom of fatigue, we do have a fatigue clinic here at Karmanos. For more information on that clinic, you can call the 1-800-KARMANOS number, the number 1-800-527-6266. Hair loss is another common side effect after chemotherapy, but does not happen with all types of chemotherapy. It usually occurs about 2 to 3 weeks after you receive your first treatment of chemotherapy. First, your scalp may hurt and become tender. Then you may lose your hair a little at a time or sometimes in clumps. It takes about a week for all your hair to fall out. The good news is that your hair will grow back. This usually takes about 2 to 3 months after your chemotherapy is finished. Remember, hair loss can affect hair on your entire body, just not on your head. This includes your eyelashes, eyebrows, arms, legs, nose. Wear a hat to prevent heat loss and protect your scalp from the sun. Wear glasses to prevent debris from blowing into your eyes on a windy day. Keep tissues handy as you may have a runny nose due to the loss of hair inside your nose. We recommend that you plan for your hair loss needs by getting a hair wig, hat, scarf, turban before you actually lose your hair. Karmanos has a booklet that helps prepare for your hair loss, and places listed of where to go to purchase these items. Stop by Supportive Services office on the main campus and pick up your free hat and scarf. You may experience nausea or vomiting as a side effect of chemotherapy. Nausea is when you feel sick to your stomach or have that queasy feeling. Vomiting is when you throw up. You may know someone who has received chemotherapy in the past and has had a lot of nausea. Your doctor will prescribe medication to help prevent nausea. The anti-nausea medication that we give today work much, much better than they did years ago. It is important to take your nausea medication as directed by the physician. Stay away from foods that are greasy, fried, salty, sweet, or spicy for the first few days after treatment. Make sure you have enough to eat and drink throughout the day. To help prevent dehydration, take small sips of fluid frequently throughout the day. It also helps to eat 5 to 6 smaller meals rather than large amounts of food at one time. If you are having difficulty or need assistance with your meal planning, ask to speak with one of our registered dietitians. If your nausea and vomiting is not controlled with your current anti-nausea medicine, contact your doctor for additional instructions. Chemotherapy can cause constipation. Constipation is when the stool is less frequent, hard, and very difficult to pass. Constipation can occur within a few days of receiving your chemotherapy treatment. Constipation may be prevented by drinking at least 6 to 8 8-ounce glasses of fluid each day. Include a glass of warmed prune juice if you are able. Limit the amount of caffeine you drink. Include exercise in your daily routine. A short walk each day will help. Call your doctor if you do not have a bowel movement in 3 days. Your doctor will give you further instructions. Chemotherapy can cause diarrhea because it harms healthy cells that line the small and large bowel. To help manage diarrhea, it is important that you eat small, frequent meals, at least 5 to 6 a day. Decrease the amount of fiber in your diet, decrease greasy food, and drink at least 6 to 8 glasses of water or clear fluids a day. If diarrhea persists and lasts for longer than 24 hours a day, please notify your physician. Chemotherapy can cause mouth changes, such as dry mouth, metallic taste, and this is because it harms the fast-growing cells that line your mouth, your throat, and your lips. This affects your gums, your teeth, your tongue, and the glands that produce saliva. If you are receiving chemotherapy, it is important that you see your dentist at least 2 weeks prior to treatment. If you require dental treatment during chemotherapy, you must talk to your physician prior to your dental visit. Take care of your mouth. Check your mouth and tongue every day. This way you can see or feel problems such as mouth sores, white spots, or infections as soon as they start. Tell your doctor or nurse about these problems immediately. Keep your mouth moist. Brush your teeth with a soft bristled toothbrush at least 2 times a day. Continue to floss if you already floss. If you do not floss, check with your doctor before starting to floss. This may cause bleeding. To decrease bacteria, rinse your mouth at least 3 times a day with salt or baking soda water for the first 3 days after each treatment. This will help decrease the bacteria in your mouth. To make this solution at home, mix 1/2 to 1 teaspoon of salt or 1/2 to 1 teaspoon of baking soda with 1 cup 8-ounce of water. Swish a small amount of the solution in your mouth at a time and then spit it out. Do not use regular mouthwashes that have alcohol in them as they can irritate your mouth. Remember to keep your skin clean as well. Keeping your skin clean and well moisturized will help avoid infection. Wash your hands frequently and bathe every day unless instructed otherwise. If you are receiving radiation, your doctor will give you special instructions on how to care for your skin. Taking care of your nails is also important during chemotherapy. Do not cut your cuticles or wear false nails, as this increases your risk for infection. You may wear nail polish and keep your cuticles pushed back. If you are getting your nails done professionally, bring your own equipment to avoid infection. Additionally, your treatments may cause an increased sensitivity to the sun. To avoid sunburn or damage to your skin, use an SPF 30 or higher, as well as a hat, sunglasses, and protective clothing when spending time outdoors. Other side effects of chemotherapy may include a decrease in your memory, difficulty focusing, and this is often called chemo brain. Other side effects could include a decrease in your vision or hearing loss. It is important to remember that these symptoms are only temporary and will adjust once chemotherapy has been completed. Because chemotherapy can have a temporary impact on your memory, it's important that you write things down so you don't become overwhelmed when trying to remember instructions, appointments, and your medication. Use your Carmanas portfolio to keep yourself organized and on track. In your portfolio, you have a medication log. It is very important that you keep track of all medications you are taking, including any vitamins or supplements. Bring this list with you to each appointment and let your doctor know if you are dealing with any medication side effects so we can help you. Also, if you smoke or use tobacco, try your best to quit during chemotherapy. Quitting smoking during chemo is especially important because the chemicals in tobacco can interfere with the effectiveness of some drugs. Using tobacco also increases your chance of infection, decreases healing, and weakens your immune system. Continued tobacco use also increases the chance of a cancer coming back. We know quitting tobacco is challenging, but there is support available at Carmanas. Ask to speak with our quit tobacco experts or about attending one of our quit tobacco classes. Remember, if side effects do occur, tell your healthcare team. They will work with you to monitor and manage your side effects. Don't be afraid to tell us what you are experiencing. Also, follow the tips in the chemotherapy and new booklet that was given to you and placed in the My Care Plan section of your patient portfolio. Call your healthcare team if these tips do not work or if you have any questions. Remember, you are not alone. We are here to help. Get plenty of rest. Take naps before and after activities as needed. Talk with your healthcare team if you are having problems sleeping. Continue your usual activities, work, exercise, and leisure when possible. Strenuous activity is not recommended. Regular light exercise is important, such as walking. Eat a well-balanced diet. Eat as nutritiously as possible. If you need help planning your meals or are losing weight, ask to talk with a dietitian. Drink 6 to 8 8-ounce glasses of fluid a day, water, juice, or other liquids, and limit your caffeine. In addition to knowing when to call us for support, it is important that you know when to call the doctor. If you have signs of infection, such as redness, swelling, rash, a fever of 100.5 or higher, please call the doctor. You also need to let your doctor know if you are having ongoing diarrhea, nausea, vomiting, or constipation, especially as it is important to keep yourself hydrated. Remember, there are often ways in which we can help with these symptoms. Also, let your doctor know if you are having problems urinating, difficulty with swallowing, or substantial weight loss. Some other cases in which you need to contact your doctor include problems sleeping or fatigue. Fatigue includes feeling tired, weak, or just having no energy at all after resting. Let your doctor know if you are experiencing dizziness, difficulty breathing, or abnormal bleeding, including blood in your body excretions. Your doctor will also give you specific instructions on when to call. If you are not sure if you need to call your doctor, please just call so we can help you. We hope that this has given you a better understanding about the side effects related to chemotherapy, and it's eased some of the fears and concerns you may have had about your chemotherapy treatment. You have been given some great practical tips, and our hope is that you'll use these tips and practice them at home. If you want more information, you can call the 1-800-CARMANUS number or go online, carmanus.org. Thank you and have a good day.